court today as Maya Kowalski's family and friends testified about the treatment she received from Johns Hopkins All Children's Hospital. Her family is suing the hospital, claiming Maya was medically kidnapped and that allegations of child abuse led Maya's mother to take her own life. Maya Kowalski suffers from a rare and painful disorder called complex regional pain syndrome. She was prescribed ketamine by a doctor not associated with All Children's, and her family said it was helping until she had a setback and had to go to All Children's. While there, her teacher came to give her lessons, the only connection Maya's mother had to her daughter at that time. She recalled her interactions with the staff.
Indifferent, sometimes cold, very disconnected. There was never a, oh, hey, Jackie, so glad you're here to, teach Maya today. She really needs, somebody to see her. Never that reception.
Well, the teacher says that Maya's mother desperately wanted to be the one who was able to see her. After months of separation, her mother took her own life. The case was detailed in a documentary on Netflix called Taking Care of Maya. The condition Maya has, again, is called complex regional pain syndrome, or CRPS. It's extremely rare, it's difficult to diagnose, and causes extreme pain. Now, it can improve over time for some, or it can become completely debilitating for others. Fox 13's Brianna Redondo joins us live in our studio tonight. And Brianna, I understand you actually spoke with someone who is living with CRPS. What did she say?
Yeah, so Allie, I spoke with Deborah Jankowski, and she was first diagnosed with CRPS in 2015, and she didn't know anything about it and spent some time finding the right doctors as well as treatments that could work for her. She calls it a disease that changed her life forever.
Snapshots of feet and hands can never capture what Deborah Jankowski feels day to day, living with a rare pain condition.
I describe it as two different things. One, a very bad sunburn, and then you take a razor to shave your legs and it feels like you just cut your leg all the way up. It's also been described as just somebody just lighting you on fire, just throwing fire on you.
That's what she says it's like to have complex regional pain syndrome, or CRPS. The National Institutes of Health says it's a rare pain disease that can follow an injury.
It's like an unseen pain. You can't see it.
And it's tough to diagnose.
I've been tested for fibro. I've been tested for MS, POTS, Parkinson's.
Deborah didn't know what it was when she was diagnosed in 2015. But ever since, she focused on raising awareness through her nonprofit, CRPS Warriors Foundation.
So whether it's finding a doctor in their area or getting them the funding for a scholarship to get the treatments they need, this is the services that we provide.
There's no cure, so treatments can range from acupuncture and nutrition to physical therapy and massage, or ketamine therapy. Ketamine is the same drug Maya Kowalski's doctor prescribed her when she was a young child with CRPS. Details that are coming up in court as a trial continues between her family and Johns Hopkins All Children's Hospital. The doctor who prescribed ketamine for Maya is not associated with All Children's, and doctors there did not agree with the treatment.
I have to make it very clear that not everybody's treatments are the same, because what works for me may not work for Maya, or what worked for Maya may not work for me.
The disease can take a toll on your body and your life. Deborah says she's bedridden right now, speaking to us with the help of her caregiver.
There's a lot of anxiety and depression that come with it. I was diagnosed with PTSD after I got CRPS. I've never had any type of history like that.
So outside of good doctors and treatments, she says a strong support system and better awareness are vital.
This is what we need. This is what Maya needs.
Now, Deborah Jankowski says that treatment, a psychologist, as well as pain management doctors, as well as primary care doctors, they are all important for patients with CRPS. And scientists are studying ways to better treat symptoms, and it also helps when doctors catch it quickly. Deborah says that she's following this trial with Maya closely, and she hopes that more people will learn about CRPS because of it. Allie?
Wow, I mean, just hearing her describe what it feels like, it just sounds absolutely brutal.